Testing. All right. Good afternoon, everyone. Thank you. Thank you for being here this afternoon. We are excited about diving into this topic and hosting this information gathering session. My name is James Green, and I just want to welcome you to this session entitled Unlocking the Potential, Harnessing Artificial Intelligence to Transform Health and Human Services. And so we will begin by having the representative from Keiser University to say a few words. So I'm going to welcome Elizabeth Houlihan to the mic. Let's welcome.
Well, thank you so much and for giving me this brief opportunity. And I love how eloquently you said my last name. I might continue that myself. I just want to say good afternoon to everyone. As a community and friend and partner, Keiser University is excited to host today's workshop. Ranked as one of the top universities in the country for promoting social mobility, a top Hispanic serving institution, and a university serving more than 20% of students who are active duty service members and veterans. We at Keiser University help students to realize their dreams. As you are likely aware, Keiser University has 2 West Palm Beach campuses that offer a wide variety of majors. As the #1 provider of nurses in the state of Florida, Keiser University offers associate through doctoral degrees in a variety of healthcare programs, as well as several additional programs of study, including criminal justice, business administration, forensic investigations, legal studies, information technology, engineering, and many more. As we offer South Florida's only Doctor of Chiropractic program, we invite you to experience the benefits of our College of Chiropractic Medicine firsthand by making an appointment at our West Palm Beach Spine Care Clinic. And actually in our lobby, we have a table there that has a QR code so you can scan it and make an appointment. It's right across the parking lot on the right hand if you're looking out this way. As an institution that provides an economic impact to the state of Florida of more than $3 billion annually and supports more than 30,000 Florida jobs, we look forward to future partnerships and thank you all you do for your support of the Palm Beaches and beyond. Thank you.
Thank you.
Oh, and I have some of my cards. I'm going to leave at the table right there. So if you're interested in partnering with us or learning more about anything, thank you very much.
All right. Thank you. Thank you very much. And now we'll have our county mayor, Maria Sachs, to come up and to offer a welcome. And then we'll hear from our commissioner, Greg Weiss.
Well, good afternoon, everybody. Good afternoon. Welcome to the workshop on using artificial intelligence to transform health and human services. My name is Maria Sachs, and it's truly a pleasure to see such a distinguished group of people here today interested in this very, very important field. Artificial intelligence, or AI, as is commonly called, has emerged as a powerful tool that will revolutionize our approach to healthcare and human services. The possibilities are endless, from improving diagnoses and treatment plans to enhancing accessibility and efficiency in service delivery. Today, we will explore these possibilities together and envision the future of artificial intelligence in our careers. Throughout this workshop, we will delve into the various applications of artificial intelligence in health and human services. We're going to discuss its potential benefits, its challenges, its ethical considerations. Our expert speakers and panelists will share their insight, experiences, providing us with valuable knowledge and practical examples. Now, this workshop is not just about listening and learning. It's also about collaboration and engagement. You will be part of this workshop. You won't need to take notes because you will be the notes itself. We encourage you to actively participate in the discussion, ask questions, share your thoughts and experiences, and contribute to this collective knowledge that we will build throughout this day of workshop. because we believe that by harnessing the power of artificial intelligence, we can unlock new opportunities to improve the lives of individuals, families, and communities. However, this is a tremendous power that we need, and it's very important and crucial, really, that we do so responsibly using this great power, understanding the ethical implications and potential risks involved in artificial intelligence. So let's embark on this journey together. Let's explore the possibilities. Let's challenge the norms and envision a future where artificial intelligence can transform health and human services for the better. I hope that today's workshop will empower, not just give you more insight, but empower each person here to embrace the potential of artificial intelligence to make positive change in our careers and really in our world. So once again, on behalf of the Palm Beach County Commission, a warm welcome to all of you. Thank you for being here. Let's make the most of this incredible opportunity, this journey really, to learn, collaborate together, and shape the future, not just of health and human services, but for our world. By the way, the question today for you, was this speech written by a person or artificial? Not going to tell you. Thank you so much, and enjoy this journey, because this is such what you do affects people so directly and so intimately that every tool in the toolbox needs to be learned about, needs to be used effectively. And this new tool of artificial intelligence, which some people will say change our world, starts right here with what you do in your own careers to help all of the people here in Palm Beach County and throughout the world. Thank you. Have a good journey. Thank you.
Good afternoon. Thank you, Mayor. And as James Green said, my name is Greg Weiss. I'm County Commissioner for District 2. So we're in District 2, so welcome. Some of you may know, some of you may not know, but about a year ago, we started to hear about a new tool, new software, ChatGPT. If you think about it, that was just over a year ago. And what we have seen in the last year, of course, is a proliferation of new tools and models that have been released. My background has been in technology. That's before I retired and went into public service. I worked in technology for many years. I was around for the beginning of the computer revolution. When I saw what had been created, I believe this is going to be a bigger impact to our society, to our world, than our smartphones, than our personal computers. This is going to be world-changing, life-changing for the future of mankind. So I'm very bullish on it. But you see the opportunities, and I know we have an esteemed panel here that are going to share their details. But when I heard about this tool and I started to think about it, and I started to really think about, and I called James and asked him about, I know you guys fill out lots of different forms. You're asking people to fill out these forms over and over and over again for this benefit and that benefit. Why don't we just use artificial intelligence, get that information one time from the individual, and let it fill out all the forms? That would improve people's lives and make sure that the information is getting to the right place. So I immediately saw that opportunity. But there are so many more, from improving our workforce. As people are retiring and we're having new people come in, what about having an assistant not sitting on your shoulder, but sitting in the device that's next to you that can help guide you as you're helping to help the people that are seeking assistance through the county. So I can't thank you all enough for putting this on. I am just delighted to be here and hear what the experts have to say. I can't get enough of it, and I think it's going to be an opportunity to transform our world and the lives of the people who live in this world in ways we can't even begin to imagine in the next few years. So I look forward to hearing about this and hearing about the great ideas everybody has. So let's have a wonderful event. Thank you.
Thank you, Commissioner Weiss. And, we are extremely proud to have Commissioner Weiss to help lead our National Association of Counties work group on artificial intelligence. And just to have someone with his vigor, his energy, his commitment to looking at artificial intelligence and using it to improve the work that we do, I think is unparalleled. I've heard him talk many, many times about ways to embrace it in a number of different domains, and we're excited to have him to work with the National Association of Counties on this project. So I want to welcome you here today because we're going to be talking about ways that we can harness artificial intelligence, but specifically honing in on the health and human services space. And so for the next 10 minutes or so, I'm just going to give you a high-level overview of what's happening with the federal government specifically. When I say we, I mean myself and the county's chief artificial intelligence officer and several others had the opportunity to have a conversation with the United States Health and Human Services Department's chief artificial intelligence officer. And he was able to, his name is Greg Singleton, he was able to share some information about the work that's happening in this space. And we invited him to be here today, but he wasn't able to come. But he was able to share information that I'm going to try to convey to you, and hopefully it'll be information that you see useful, and you'll understand why it's important for us to really work with U.S. HHS on these types of projects. So in recent years, artificial intelligence has emerged as a powerful tool, revolutionizing various industries, and of course, the health and human services sectors are no exception. AI has the potential to enhance decision-making, improve client outcomes. It has the potential to optimize resource allocation and drive innovation in these critical areas. So by harnessing the power of AI, we can unlock new possibilities and transform the way we deliver care and support to individuals and communities. Understanding the initiatives and the efforts of the federal government in this space is of the utmost importance because the federal government plays a significant role in shaping policy, regulations, funding opportunities related to AI, specifically in the health and human services space. Therefore, staying informed about their activities and priorities is crucial for organizations and professionals working in these fields. Collaborating with the government allows us to align our efforts, our local efforts, to share best practices and leverage available resources to drive meaningful change and address societal challenges much more effectively. And so some of you are aware that back in October the 30th, the President of the United States issued an executive order at a directive that outlined the government's strategy and approach towards advancing AI technology. The executive order focused on three pillars: promoting AI research and development, ensuring AI's adoption across government agencies, and fostering public-private partnerships in AI. Additionally, the executive order called for the adoption of AI technologies across government agencies to improve efficiency, effectiveness, and service delivery, and it emphasized the need for agencies to develop and implement AI strategies to enhance workforce skills, establish governance frameworks, and for responsible AI use. And so, within 90 days of the executive order being issued, the U.S. Department of Health and Human Services, in consultation with the Secretary of Defense and the Secretary of Veteran Affairs, are required to establish a Health and Human Services AI task force. Within 180 days of submitting the AI executive order, the Secretary of Commerce, in coordination with the Office of Management and Budget, will develop guidance regarding the existing tools and practices for digital content and authentication and synthetic content detection measures. Also, within 180 days, they're required to develop and publish principles and best practices for employers that could be used to mitigate AI's potential harms to employees' well-being and to maximize the potential benefits. The principles and best practices should include, at a minimum, specific steps for employers to take with regard to AI to mitigate job displacement risk, career opportunities related to AI, and it should account for issues related to equity, collection and use of data about employees, including transparency, engagement, management, and activity protected under the worker protection laws. Within 240 days of the executive order, the Secretary of Commerce is required to submit a report to the Director of the Office of Management and Budget and the Assistant to the President for National Security Affairs, identifying the existing standards, tools, measures, and practices, as well as potential development of further science-backed AI standards and techniques. And within 270 days, the Secretary of Commerce is required to develop guidelines and standards and best practices for AI safety and security. Within 365 days, the HHS department is required to develop a strategy for regulating the use of AI and AI-enabled tools in drug development processes. And within 540 days of the executive order's publication, the director of NSF should establish at least 4 new national AI research institutes, in addition to the 25 that are currently funded. And so HHS recognizes the importance of artificial intelligence, of course, in transforming the health and human services sector. And so they developed a strategic approach that aims to drive innovation, improve outcomes, and enhance the service delivery for human services. Now, this strategic approach really encompasses 4 pillars. Number 1 is data. The department is committed to promoting interoperability, privacy, and security to ensure the ethical and responsible use of AI in healthcare and human services. Number 2 is infrastructure. So HHS looks to build a robust infrastructure that supports the development and deployment of AI technologies. And this includes investments in computational power, cloud computing, and data storage capabilities, as well as the establishment of partnerships to leverage expertise from academia, industry, and other government agencies. The third is workforce. So they acknowledge the need to develop a skilled workforce that can effectively utilize AI in healthcare and human services. And they're committed to providing training, educational opportunities to healthcare professionals, researchers, and policymakers, enabling them to leverage AI tools and techniques to improve decision-making and service delivery. And the fourth pillar is ethics. So Health and Human Services, they place a strong emphasis on the ethical considerations in the development and deployment of AI. The department is committed to promoting transparency, fairness, accountability in the algorithms and systems, and it seeks to address biases, prevent discrimination, and ensure that AI technologies are used in a manner that will respect individual rights and promotes equitable access to healthcare and human services. Now, in terms of the governance and the execution of AI, you can go to HHS's website and see much of what they put in place. They've taken significant steps to establish dedicated offices and task force. They've created the Office of Artificial Intelligence within the department. And so this serves as a centralized hub for AI-related activities, providing leadership and strategic direction and leveraging AI technologies to enhance health and human services. This office focuses on fostering collaboration, promoting innovation, and ensuring the ethical and responsible use of AI in HHS programs and initiatives. In addition to this office, I mentioned they will establish the task force, and that will be comprised of subject matter experts from various disciplines, including healthcare, technology, policy, who work together to identify and prioritize certain areas. And this task force will conduct research, develop recommendation, and advise HHS on AI-related policies and regulations and best practices. And then they're also pushing for a council on artificial intelligence for the White House. And this will serve as a high-level advisory body guiding and coordinating AI efforts across all of the different federal agencies, including HHS. And this council will facilitate collaboration, again, share knowledge, and ensure that the alignment of AI initiatives will serve the country's broader priorities. And these initiatives will demonstrate the commitment of the federal government to harness AI's potential in transforming health and human services and government overall. And so what they've done, and as you heard, the Office of Artificial Intelligence hired a chief artificial intelligence officer by the name of Greg Singleton, who's spearheading this work. And what HHS has done is published what's called a playbook. And so it's called a trustworthy playbook. And it's a comprehensive guide that aims to promote the responsible and ethical use of artificial intelligence in the healthcare sector specifically. What it does is it provides a framework for developing and deploying AI systems that are transparent, that are fair, secure, and accountable. And so this playbook emphasizes the importance of protecting patient privacy, ensuring algorithm transparency, and mitigating biases for AI models. It also highlights the need for ongoing monitoring and evaluation of AI systems to maintain their trustworthiness. So overall, the playbook really serves as a valuable resource for organizations seeking to implement AI technologies in a responsible and trustworthy manner within the health and human services domain. And so that kind of gives you a high-level overview of what's happening within our federal government. And that's important, again, because we want to make sure that we are following their lead and that we're taking advantage of many of the opportunities that they have to fund initiatives at a local level to advance AI. And so now we get into the juice. And I'm really excited about our partners here today, Deloitte. And we're going to invite, I just referred to them as Mo and Naaman. We're going to invite them to the front, and they're going to share a little bit about some of the work that they're doing in the AI space. I think we're going to make a shift very quickly in getting their computers and everything set up so that they can provide you with a presentation. And then we're going to take a quick break, and we'll have a panel to come up in the second half of the day. And that panel will consist of the Chief Information Officer for Palm Beach County. It will consist of the Deputy Director for our Community Services Department, and then our Deloitte representatives. And they'll be able to answer questions from the audience and questions that we have prepared in order to continue this information gathering session on artificial intelligence. Okay? So let's get them set up. You guys need a little time to set up? Okay. So let's welcome Mo and Naaman.
All right, I think we're ready. Hello, everyone. My name is Mohammad Fasihi. I go by Mo. I'm a managing director at Deloitte, and I spend a lot of time with state and local governments working on health and human services and digital transformations, usually on large systems, taking the legacy systems and bringing them into new transformations on around the digital age. I spent a lot of time on AI, and I'm really excited to be here to talk to you about some of the things that we're going to do. We're going to have some demos as well. But before I jump right into it, I'm going to go ahead and give it the name and to introduce himself too.
Thank you, Mo. Good afternoon, everyone. My name is Chaurasia. Pleasure to be with you all. I have spent the last decade helping health and human services agencies nationally at the state level. My wife is a social worker herself, so this is kind of close to heart. And over the last 5 years, I have focused specifically on artificial intelligence in health and human services. And with the advent that Commissioner Weiss was talking about with ChatGPT, it is gone from the fringes in terms of conversation to front and center. So we are excited to talk to you about what does that mean, what are some use cases, what are some considerations that we should have when we think about this technology specific to health and human services. So with that.
Yeah, thank you. So today's agenda, as you see up on the board, we're going to go over a couple of use cases. We've got some demos here that we've put together. We use a lot of different platforms. We use Google, we use Amazon, we have Salesforce, we have Microsoft, and we have Java. So we use all these different platforms to be able to build these solutions and be able to show you what are some of the things that we could do with AI. So you'll see some of those. We'll also have some discussions on trustworthy AI. That's something that's very important to me because the framework is there, but it's not very simple to get to. It's very easy for it to be biased. It's very easy for it to make decisions that aren't right. So what we need to do is we need to make sure that we're providing it with the right set of data and the right information and how we're transforming our organizations for it to become trustworthy. It takes a little bit of time to do that. And then at the end, we'll do some questions and answers as well towards the end. But, you know, speaking of ChatGPT, that's been like a hot topic in my household. I have a senior in high school, and a lot of the kids were talking about using ChatGPT to write their to write their essays. And you know, we're at a university here, and a lot of times they're reading the essays. So how do the universities even tell that if it was written by a person or if it was written by ChatGPT? And that's something that's out there. I mean, where a lot of the resumes, a lot of things that we're coming across, we're starting to see some of the markers that show that it was written by AI and not necessarily people, and how to address that, right? Is that a knock on the person or is that not a knock on the person, stuff like that. So those type of decisions are pretty hard, and it's not a simple, you know, black and white answer. And we'll go through that. We'll talk about some of these things. So with that, I think we'll go on to the next slide. We'll talk about a question that we have for you. Now, on this question, it is, what is your perception of, of Gen AI? With a raise of hands, can people tell me how many of us in the room are optimistic about Gen AI? All right, got a few people here. Tito, you got the count? Good. All right. Next one. Cautiously optimistic. All right.
More. Better. Keep them up.
There you go. Yeah. All right. Let's go to the next one. Who's neutral? That's me. I'm neutral in the middle over there. Yeah. I'm still trying to get used to my iPhone, so. Yeah.
No, you can change your votes.
Yeah, you can change.
You can change your votes.
Skeptical. How many people are skeptical about it? And then I like the last one. Negative. Who's negative on this one? It's okay to be negative.
Well, the interesting thing is that probably half of the room is optimistic and cautious.
Yeah,
That's a good sign.
that's a very good sign. And no one's really thinking about Terminator. That's good, right? And then there's the last one, right? The last one is, is it the generation after the millennials, right? Is that what Gen AI is? So I guess with that, let's go on to the next slide. And, when I think about AI, a lot of questions come up. And we feel these questions often. One of the questions that always comes up is AI out there to replace me? And that is something that we do need to think about, and we need to take this head on. Is it really out there to replace me? And it's very similar to the conversation I was having with Dr. Green with toll operators, right? There was a time that there was a person at every lane, and now you don't have people that are at every lane. But jobs are still there. There's still jobs out there. They just do a different role. And there is a little bit more efficiency there. You do have some cost savings with not having people out in the middle of the road all the time and having to drive over there. So there are definitely some changes there. The next item that we come across is how accurate is AI? And it's only as accurate as the data we have. But we do know that the data we have is not necessarily the cleanest data out there. So there is a bit of work that we have to do in making sure those legacy systems have clean data, because those legacy systems are the ones that are going to be coming in to the repositories that AI will use to be able to furnish all of the data. Like, very similar to what Commissioner brought up when he was talking about filling out the applications for you. So if we have the right data on the person and we're able to match up the correct person, then can we fill out the application for them so they don't have to fill it out over and over again? I mean, I personally don't like it when I go to the doctor's office and I have to put in my first name and last name over and over again on every sheet, even though it's still on an iPad now, but I still have to do it on every sheet. Why can't I do it one time, right? And then the last piece of it is, can it be trusted, right? And Deloitte was heavily involved. We're proud of that. We're very involved with HHS, with the federal agency, in putting together the playbook and putting together the guides and the strategy around it. And making sure that it's trustworthy has been one of those things that will take time. It won't happen overnight. Even today, what we've realized is that the data is not clean enough for us to be able to make those strong decisions. We can't make the 100% decision that's out there. In fact, there's been certain places where we've been doing AI for more than 30 years with our with the defense agencies, and yet we know that less than I think it was 33 or 35% of it is accurate. So it's not easy, being able to get there. Now, which way are we moving? We're moving to a point where once we have these shared repositories and we can then analyze the data, we can then get to a more accurate way. But making sure that we're following in that strategy around making sure it's not biased, making sure that it's not making decisions that could actually hurt people rather than help people. And the whole goal for HHS is to be able to build systems and to be able to use AI to help and be able to provide more services. So with that, I'll give it over to you, Naman.
Thank you. we're talking about bias. I think that survey we did at the beginning was biased because not all of you saw all the options before you chose your answer. But as we go through this presentation, I want to break it down into 3 segments. The first segment, I'm really going to talk about when we say AI, what does it mean? So for some of you, it may be I know about it, and so I apologize in advance. It will be a repetitive conversation. But I want to start from the basics of what AI actually is and what AI is not. So we'll spend about 10, 15 minutes doing that. The next part, I'm going to talk about what does AI in health and human services specifically mean. As I mentioned to you, my background is all in health and human services. So when I think of somebody providing food assistance, somebody providing homeless services, what does that mean for me as a staff, and what does it mean to the individuals and families that I'm serving? So the second part is going to be about that. The third part is going to be a cautionary tale. What are some things that we should be aware of when we think about these technologies? Because clearly, if AI was here and we wanted to apply it to everything, Mo and I wouldn't be here talking about it. So as we think about applying AI into our day-to-day lives, what are some things that we need to be aware of? So I'm going to break it down into those 3 segments. So first segment on what AI is, and the way we like to think about it at Deloitte is we put it in terms of 2 segments. One is how much human touch is required. That is what you're seeing on the y-axis here. And on the x-axis, you're seeing how complicated is the task. AI is not a monolith. It's a collection of technologies that's broken up into different groups that can perform different actions. So when you think of AI in these 2 spectrums, it really is a spectrum of technologies. So we start with the smallest one, which is RPA, or robotic process automation. When you have repetitive stuff, so I need to log into a system, I need to download a file, I need to upload that file into another system. That's a repetitive task. That technology to do that is called RPA. That's been around for more than a decade. And I was actually talking to Taruna before the presentation, and she said, we're already using some of those technologies. So this is stuff that has been around. So when we say AI, it starts from the very simple, which is here on the left-hand side. The second group of technologies is intelligent automation. So many of us have called our airlines or banks, and we have had to talk to chatbots or voice bots. That is nothing but intelligent automation. It's trying to understand you in a natural language fashion. You're trying to talk to it, and then it understands what you're trying to do and is giving you a set of curated responses that it has been trained with. So things like chatbots, things like when you take when you deposit a check for your bank and then you take a picture and it reads information from it. Those are technologies which are in the intelligent automation spectrum. So that's the second spectrum.
No, I did want to say, with the intelligent automation, it never understands when I say the letter F or S.
Yeah.
It's just maybe my voice, but it just always confuses the 2 of them.
Yeah.
And my last name starts with an F, and the third letter is an S. So it always gets the wrong name for me.
The third group is called cognitive analytics. So think of like traffic cameras that detect a vehicle that is traveling faster than the speed limit, and then are able to get the license plate and send a ticket directly to your home or where the vehicle is registered. Those kinds of technologies are what are in the cognitive analytics spectrum. The fourth group is narrow AI. This is where generative AI sits. So these are technologies that are creating content based on what has been fed before. All of the other technologies that we spoke about are not creating any new content. This is the first spectrum of technologies where it is actually creating content. So when the mayor spoke and she was like, well, I leave it to you to guess whether the speech was written by ChatGPT or not, is because it is very human-like. And we'll talk a little bit more about that and how does that work and what that means. But that is the fourth spectrum of technologies.
So is that like when I'm on Instagram and it can tell which are the videos that I like, it just gives me those
Similar
over and over
videos
again?
over
Okay.
and over again.
Okay.
And then the last one is general AI, and this is where I want to talk about Skynet, iRobot, Terminator, because a lot of people think that, oh my God, AI is here, it's going to replace us and all of that. From a technology standpoint, we are many, many years away from it. These machines can produce human-like outputs, but they don't have any capacity of understanding. They don't have any capacity of what's right or wrong. They cannot make decisions. They're not self-sustaining. So we are far away from this technology or this concept of general AI. So when we think about the spectrum of these technologies, like I said, RPA has been around for a long time, versus generative AI was just a year old. So when you think about these 5 spectrums of technologies, they range from very mature technologies that have been in existence all the way through emerging technologies. Let's go to the next slide. And we want to talk a little bit about a couple of examples. So we'll start with a chatbot demo. Many of you have seen or interacted with chatbots, but I want to show the concept in action and say, when we talk about being on the left side of the spectrum to the right side of the spectrum, what the difference is. So here's a chatbot on the Montana Health and Human Services website. And it's a little small, but I'll read it for the audience here. So you're talking to Sophie, which is a virtual assistant, and Jess is typing, "I need food." It provides an answer and says, "It looks like you're interested in applying. Please click from one of the following options." And it's providing you options of you can apply online, check if I'm eligible, learn more about the application process. Let us change the question a little bit. Let's say, how do I apply? It provides the same response for that. So all it is doing is it's trying to understand, oh, you're doing something around application or apply is what you want to do. And this is what I've been trained in, and I'm going to present the same answer over and over, no matter how you ask the question. So it's understanding you in different forms and producing the same static answer. When we will go and show you generative AI, you will see that the big difference is instead of regurgitating the same responses over and over, it creates new content personalized to you. So if you would have said something like, how do I apply? It would have said, here is the application process and click on this button and start applying. Versus, I need food, it would have said, here are the local food banks available in your area. Like things like that. That is the difference between what was traditionally a chatbot technology versus what we have right now, which is generative AI. So here is another example where Jess is going to type, where are the closest homeless shelters? It's going to say, sorry, I didn't understand that. Even though the Montana Health and Human Services Agency provides information on homeless shelters and things like that, it's just because the chatbot was never trained on that information. So when it's not trained on it, it just says, I don't know, instead of actually directing you to that web page.
You've used the word train 3 times already.
Yeah.
That's the key.
That is the key. Training and the data is foundational to it. So this is just an example. So when we are talking about the different spectrums of AI technology, this is in the second spectrum, which it kind of sort of understands human language and it provides some static responses and things like that, but it doesn't create content. Now let's talk about generative AI and why we are really here and why AI is front and center. When we talk about generative AI, I was actually Googling this while Commissioner Weiss was talking about that generative AI has been around only for a year. Do you know how many years it took for smartphones to go from 0 to 100 million users? Any guesses?
0 to 100 million?
Yeah.
You're saying smartphones?
Yeah. It took 10 years.
10 years?
Yeah. Guess how many years it took Facebook to go to 100 million users? 5 years. Guess how many years it took ChatGPT to go to 100 million users? 2 months.
How
That-
about from 100 million to like 1 billion?
I don't think they're there yet.
Oh.
But
Well, since we were talking about
Yeah.
stats, you got all excited.
but that is the reason why we're here. Why generative AI is so front and center is because it's impacting not just health and human services, it's impacting society. We had the example where most kids are like, can I use ChatGPT to do my homework? Can I write it to do my essays? Like everybody is kind of using it and already involving. That is why there is so much focus on regulation around it. So what is generative AI? At its very basic form, generative AI is an AI technology that can create new content. that create new content can be text, can be voice, can be audio, can be video, based on the information that you have provided it. So I'm not going to bore you with all the technical details around this, but just so understand that this is trained on foundational models and human language, and that's how it's able to create this net new content. So there are 5 modalities that it creates. I don't know if anyone has Googled this or not, but one of the first images that generative AI created that went viral was this person sitting on a horse on the moon. Obviously, that was not a real example, but it created it and it looked very real. So to show you kind of how real this can get, we actually have a couple of exercises for the audience here. There are 3 images that you're seeing on the screen. Who wants to take a guess on which which image was created by generative AI? 3, 1, 2. Why? Okay. Why 3?
I don't know, I just feel like you could put prompts in saying, old vase, flowers with some highlights, tulipish, not super healthy. I don't know.
Yeah, it could be any 3. It could be a trick question. It could be all 3 of them. That's where Tito is. Or none of them, yes. The correct answer is number 3, and that was the prompt. And the reason why it is 3, I don't know if this is visible or not in resolution, but it's almost too real. It looks too real. And that's how some people, yeah.
The one that was too real.
Yeah.
The number 2, I thought, what if that's some like real painter, but it was too perfect. Although there are artists that way, but it was too perfect.
Yeah. So that is an example here. Let's look at the next picture here. Which part of this image do you think was created by generative AI?
The mountain.
All right. Which mountain?
The one straight ahead.
Okay. The snow mountain. Someone saying water. The reflection. The whole thing. The answer is the left and right portion. So the middle portion is the only thing that was available to the tool. And this was actually created in Adobe. They have this tool called Generative Fill. And we said, can you expand this picture to make it more real? So it created all the stuff on the left and the right to just make it more real. And so
So the reflection is real.
The reflection
boats
is
are real.
yes.
Oh, wow.
Yeah, but it created all of that stuff. And if you go back, Jess, you see these trees on the left? It just put them there. Yeah. All right, let's go to next. So how do they work? Like, we can see clearly that they look very human-like, they talk very human-like, or they create things that seem to be human-like. So how do they actually work? The way we look at it is, we think of GPT or any of these large language model technologies as babies. As infants start to understand the patterns and the speech and the things around them, they start saying the same things. And they're like, I think I know the meaning of that. I'm going to start using it. And then there's a difference between what a 3-year-old speaks versus what a 6-year-old speaks. So over time, they kind of get better. So that's the way to think about these technologies. So they're trained on everything that is out there on the internet, good, bad, or ugly. Then you can put in user prompts, which is you can ask it questions. You can say, make this image bigger. I have a presentation tomorrow. Can you come up with talking points that will resonate with an audience, right? It can come up with stuff like that and then answer those questions for you. So if you keep going, there is a constant loop of feedback. So if I were to ask you peanut butter and, that is exactly how GPT works. It's predicting the next word based on whatever is the most likely word. That is where, when I started at the beginning of the presentation and I said these machines or these models don't have thinking or reasoning or decision, is because all they're doing is predicting the next word. When you look at the collection of those words together, you're like, oh my God, that looks like somebody wrote it. because they're very human-like, because they've been trained on human language. And so one of the things that LLM technologies by default do really well is translation. You can have a manual in English, and you can ask it a question in Spanish, and it'll respond back in Spanish, interpreting that manual. It does that because it understands human language.
Now, I mean, real quick, what is LLM?
LLM stands for large language model. So when you think of GPT, that is an example of a large language model, and there are thousands of such tools that are out there. So that is how these technologies work. So when you think about like, how does generative AI work? The simplest way to think about it is it's just predicting the next word. And all it is a mathematical model. It's saying after peanut butter and, the most likely word is jelly. But the right answer could be peanut butter and chocolate. It could be anything else. But it doesn't have a concept of right and wrong. It just has a concept of whatever I think is the mathematically next correct word, I'm just going to put it out there. And the same concept applies to an image. When it's creating an image, it's just putting, let me put a tree here. That might not be the right thing to do, but it's just putting it because it thinks that that's the most likely thing to put there. So let's keep going. The last portion is what I really want to pay attention to, and we'll come back to this concept when we talk about this in terms of use cases. You have to be the judge of the quality of the content. Like I said before, I think Mo started with it. You know, when you think about it in terms of impacts on jobs and things like that, it's not there. It's very far from it, in fact, in terms of replacing or anything like that. But you have to use it in the right ways and then make the decision on it. The human is still key in this and will always be key in this because these machines cannot act, think, or decide for themselves. So you have to take outputs from this and say, is this valuable? Is this correct? Is this something that I can actually act upon? Do I want it to do something different? So it is just a model that you're giving it information and it's spitting out something. You have to be the decider of how to use that and if that is correct or not. So that aspect, in that aspect, it is very similar to an infant. We don't let infants or babies drive vehicles, make decisions, go to work. Well,
In Miami.
in Miami, yeah. But that is the same concept here is when you think of generative AI applications, you have to think about a human validating the responses or validating the outputs because the model by itself cannot perform these actions. So
This is something that, the last piece that you just talked about, it's very important because we have efficiency that we're all looking for. And in the government world, you have a lot of cases that you're working on. And then the cases pile up. And when they pile up, who is the person that's impacted the most? Who's impacted the most? It's our constituents, our folks in the city, and the folks that actually need the benefit. They're the ones that are impacted. So that's where AI can help a caseworker be able to work through more cases, right? Rather than taking over the job and doing the job for them. And that's where you'll see some of the examples where it's really all about efficiency is what AI is trying to do rather than replace person. Because I don't want to be replaced. I don't think I could be replaced. I'm just going to behave that way, right?
Any questions?
Yeah, does anybody have any questions?
Continue? In the panel discussion too, but we should always look at it as using this as another tool in the toolbox, right?
Yep.
So what it's going to do, it's not rip and replace what you're doing, but it's going to augment your caseworkers or whatever, so that they can do the complex stuff and let this technology look at the mundane, repetitive stuff.
Mm-hmm.
And if you look at it that way, then there's no need to worry about your job or anything. It's just going to make you more efficient. So as they talk about, just the Gen AI, that's what you got to think about, is how can this augment what we're doing? And how can it look at our data and make it more efficient that your caseworkers, your agents can be able to do your jobs
Yep.
in a timely manner.
Good. So the next segment we're going to talk about, now that we have a good foundational understanding of what AI is, it's a spectrum. What generative AI is, it's AI that creates content based on mathematical models. Let's talk about how do you apply this and what does this mean for health and human services specifically. So as Archie just said, with generative AI, we can work smarter, not harder. And that's really the key takeaway. And so let's talk about that in terms of certain use cases. So when you think about use cases, putting together summaries of documents, that is something that Gen AI can do very easily. You can load hundreds of pages of policy manuals, or I was talking to somebody about this before the presentation. When you think about case management, you could load in all the history of case notes from the last 2 years and say, can you give me a summary of what's going on with this family? And it can do that for you. You can do things like, hey, this case was recently transferred from another case manager to me, and I don't know what are the different situations that this family is currently facing through. Can you look it up and tell me what's going on? It can create summaries, very powerful, very effective summaries based on that. Now, are those summaries 100% accurate? What data they have been trained on? Those are things that you need to check, but it can create an initial point for you where instead of spending maybe 2-3 hours, you have to spend maybe half an hour on it. So that is where it can make things smarter so you don't have to work harder for you. The second example is question and answer. So the chatbot that we saw, I'm going to show you a different chatbot that uses generative AI technologies and show the differences. So I'll get to that in a second. But let's keep going through. We have other uses for it, which is content transformation. So for Mo does this with legacy applications and transferring those codes over to modernized applications. It can actually rewrite your code for you from certain languages. Now, it does better at certain languages than others, but it can accelerate your transformation from something written in COBOL or Natural to I want to migrate it to Java or some modern technology. It can do that content transformation for you. Classification, it can classify images for you. Can you, like, how many of us have gone to the website that says, click all the circles that have the traffic light in them or that have cars in them and things like that? And those security tools are going to become more annoying because AI is now powerful enough to do those things now, right? So it can do things like classification now where it can say, I see a car in this, or I see a traffic light in this circle. So it can do content classification. It can do extraction of information. It can do image generation, as we saw before. Reasoning. This is something for any of you who are involved in budgeting processes or involved in any legislative kinds of things. It can do reasoning for you. So, for example, I am working with a client right now. They have about 3,000 administrative rules. And one of the questions that some of the community partners asked them was, you always keep increasing that. The number never goes down. Have you evaluated why do you have 3,000 rules? Is it a federal mandate? Is it a state legislature mandate? Like, why do you have 3,000 rules? So they are right now in the process of using generative AI to understand, is there something that is behind this? Like, I have this administrative rule. Can you go and search for the CMS website and see, is there a CFR that this rule is being driven off of or no? And so they're going through that evaluation because it can do reasoning and come up with why this thing exists. And the last one is text content generation, which, you know, if you're writing out contracts, for example, it can create wonderful first drafts for you.
Again, first drafts.
Yeah.
Right?
And
It's the final.
they're not final. And one of the jokes that we have is that day is not far away when your AI is going to be talking to my AI.
Yeah.
Because I'm going to write an RFP or a contract out based on AI, and I'm going to say, take these 2-3 sentences and build this out into a 10-page RFP. Mo's going to take that and say, can you take these 10 pages and summarize this for me in 2-3 bullets? And so there is potential for a day where all of us have our AI agents kind of talking to each other, but that is what the textual content generation could look like, where it's taking your idea and expanding upon that idea. So let's talk about that in the context of health and human services specifically. We like to think of it in personas. So we have 4 personas here. I'm going to focus on the first 2. Hopefully these resonate with you all. The first is a resident. So Julia, she just lost her job last week, is the primary provider for her family. She has a 15-year-old granddaughter and a 12-year-old grandson. She has heard of food stamps before, but has never navigated the social services system. So let's talk about, when you think about Julia, how can AI actually benefit her? So if you, if you think about somebody who's coming in to interact with health and human services for the first time, it can be pretty overwhelming. There are so many pages and so much stuff to navigate around that you always need a person to say, hey, here's what's really going on with me, can you help me? And so AI can be used to personalize content to that person based on their situation and their need. So for example, you could use AI to say, you're potentially eligible for SNAP, but did you know based on your situation, you could also get Medicaid and TANF. That is something that systems don't do today. Today, you have to declare, here are the 4 programs I'm applying to, so evaluate me for those 4 programs. Using AI, you can take that almost out of the application process and say, let us get your data and your needs. We will tell you which programs you're eligible for. So it almost like turns the concept of person-focused services at the center. The second is like tailored text messages. So I know many of you interact with your clients and constituents you serve. You probably write out letters to them or notices or call them or send them a text. You could have AI do that for you. So this could be an assistant for you where you can say, I have this going on, can you contact Julia and tell her like this is what's going on with her case and this is what we need from her, and the AI will send her a text. And you can even say, please remind her that her appointment is on Friday at 10 a.m. And so it'll send a text to her on Friday morning and say, hey, reminder, you have an appointment with your caseworker today. And so AI can do these kinds of things. And so we have a few use cases around these concepts, but the one that we're going to show you today is the navigation engine. So we're going to show you something from New Hampshire that we are working on as a proof of concept with their human services agency. But so right now, Jess is on the New Hampshire website. It's called NHEasy. Let us say I want to know where the nearest homeless shelter is. Let us see how that process is done today. So she clicks on services. There's a bunch of filters and fields here. What do you really need? So I need to understand all of this. Then I'm going to click on housing because I'm going to be like, I need something with homeless shelter. I think that's related to housing. So I'm going to click on that. Then I'm going to go back and see, okay, housing services. I'm going to click on that button. That takes me to homeless services. Then there's a bunch of stuff on it. And I have to find the right link, and I have to say, all I need is...
You're already stressed out, though, right?
I am stressed out. I don't know how to navigate this. And then, yeah. And so half of these terms, I don't even know what they mean. This is the first time I'm interacting with this website. At this point, in reality, I'm probably going to pick up a phone and call somebody. But for the sake of the demo, let's say I'm persistent and I want to keep going. So I click on shelter services. Then within shelter services, this is where I finally see, okay, here are all the shelters, and then I can see the shelter contact information. Now how...
We've got a knock on the way, by the way. We're not knocking
Yeah.
New Hampshire here.
Yeah.
Yes, sir.
This is actually one of the better designed websites, if you may, in terms of the information that is available. The point we're trying to highlight is access to that information is hard. You almost have to navigate everything yourself. You don't have any support unless you call somebody. You call a social worker in New Hampshire and they'll help you, unless you do that. Now let's think about what the future of this could look like if we had AI technology. So here is a generative AI chatbot, so that uses some of the complex technologies that I spoke to you about in the AI spectrum, that is sitting on top of all of this information. So what
Terminator, the T2000, this is what you're showing us?
it is 10 steps before that,
Oh.
but yes. So Jess is going to type a question on this and just say, I need food. Instead of previously where it said it looks like you're trying to apply, it directly goes to SNAP. And it says, this is the SNAP program, and then the eligibility is dependent on your household size, income, and all of that. Click this link, and you can actually access food benefits. Let's take the homeless shelter example. And so she's typing a question saying, where is a homeless shelter? And then it is able to derive the information from that page and bring in, here are the different homeless shelters available, and this is what you do. Now, if I say things like, I'm pregnant, can you find me a place to sleep tonight? From within those shelters, it's going to say, here are 6 specialty centers that focus on pregnant women, and here's what we can do. So that is the difference, that instead of me as Julia trying to navigate all of this for myself and finding out, okay, here are the 4 or 5 places that can actually help me, I can ask a question here and it will figure the stuff out and give it to me. Now, there are some considerations and some risks with doing this, which we'll go through, but this is sort of an example of how you can use AI on top of your own data to make access for residents simpler. Yeah.
So for a lot of the cities and a lot of the states, we're working on, oh yeah, sure. So for a lot of the cities and a lot of the states, we're working on these citizen one-stops and these no wrong doors, which is designed to get folks to this information very quickly, and that they can answer 5 or 6 questions. It retains the answers and then helps you apply for all the different services. And then also tells you there's 7 or 8 other services based on what you've answered that you can still apply for. And it's very similar to LinkedIn, where you can just hit apply like you would on LinkedIn, and it'll just send your applications out to all the different agencies. That does speed up the work. It also speeds up the work for the caseworker, because now all the documents are coming in, and it's flagging if someone missed a document, or remind them, you missed the document, email it to us, or load it in there, so the caseworker also doesn't have to do that. So those are the type of like little things that we're using AI for. Not, a lot of times when we think AI, we're thinking, futuristic, or what was that movie from Tom Cruise, where, not iRobot, Minority Report, yeah, where people start thinking that it's not really there. It's more on helping people find information.
Yeah. And then the other concept when you think of residents is this one-size-fits-all approach. Anybody who has worked in health and human services knows each situation is unique. Mm-hmm. And so you have to, the value that you as a social services staff or manager or provider of services provide is you are tailoring what is available from the state or the county or the city specifically to that family. So when you think about that, there are examples that start from the easy, like right now I work in one of the states where they have 115 different spoken languages, but their website is only accessible in 7. You can use generative AI to have an assistant that can help with the other languages. Because, again, remember, it understands human language well, so why wouldn't we? Why wouldn't we use it to speak a language that I only have 1 or 2 interpreters in the entire state to do this, right? So it can make access to information much easier for residents.
And this is something that we were talking about, Commissioner Weiss, which is the population of your resources moving in and out. And this is where you could train faster. So one is helping your constituents and the folks that are in your community. The other is the folks that are within your establishments and that are new and may not have the knowledge that folks that are close to retirement age or have moved out of your agency. So you can train them faster where they can just ask these questions and they can let them know where certain information is.
So those are some examples from a resident standpoint. I want to cover a few examples from a staff standpoint as well. So I think this use case persona of Robert is going to resonate well with this audience. He feels his work is never done. He feels unorganized with so much information coming in. He's extremely frustrated with new policies, regulations. Communications with clients continues to be challenging. He's just overwhelmed. And for any of us who have gone through the pandemic, we know that the caseloads have only increased, and the capacity to process that from a staff has only decreased. So when you think about AI, it is one of the tools that can fill that gap in terms of demand versus capacity. So how can AI help Robert? Robert can use AI to perform data entry for him. So in many jobs, we have to do a lot of data entry. Even Mo and I, we have to do a lot of data entry. You can use AI to automate that data entry for you. And we'll actually show you an example of it.
And I don't type with all 10 fingers.
Yeah.
It's just mostly thumb and one finger.
Yeah.
Takes a while.
AI can be used for getting information from policy. This is actually a production thing that we have helped a couple of states with right now, where there is 1,500 manual pages of manual. And instead of me trying to hit Control F and trying to find that word, going to that section, trying to understand it, we have put AI on top of it, and now you can ask any question. So for any of you who work in the SNAP program, there is this concept of able-bodied adults without disability, so without dependents. So you can say, Bob is an ABOD, and Mary is moving in with him. Does ABOD concept apply to Mary? And it'll go through the policy manual and give you the answer rather than you having to figure the answer out, right? So those kinds of things, it can help you do better and faster. And again, in none of these examples am I telling AI has replaced that person. I'm just saying instead of you spending 2 hours on it, you're now spending 15 minutes or 20 minutes doing it, but you're still the person who's taking the decision. So there are other things that AI can help with. We'll show you a few examples. We'll talk about a few use cases. There's one that I want to cover that I think is going to transcend us in terms of this presentation and this moment in time, which is the co-pilot concept. Commissioner Weiss spoke about it, but if you think of a co-pilot, it can do things like accelerate your onboarding for you. So your on-the-job training used to be with an experienced worker. It could be with an experienced AI assistant, where I could go and ask it simple questions instead of going and talking to my lead worker about it. Just as an example, I could accelerate my offboarding process. If I'm moving and if I'm offboarding, I can automate that process and I don't need to go through that process. So this concept of a co-pilot to help me with all of my cases, I think I was talking about the case note summarization one. You could have your co-pilot do that for you. Say, hey, can you go through this case for me and just tell me what are the 3-4 things I need to know? Or if I'm doing a fair hearings appeal and I need to go to court, I can create an initial summary of the case rather than me having to dig that and dig the 5-10 bits of information. I can use AI to do that. An example that we're going to see is call center related. So I don't know how many of you work at a call center or are part of, okay, we have a couple. You have to often be on the phone, try to understand what really the individual or the family is suffering from or what can I help them with. At the same time, you're also doing a lot of data entry because you don't want to miss anything that they've said. And so what AI can do for you is take that data entry out of the thing so you can focus on the family. So we're going to show you an example here. Jess is actually going to plop in a transcript of a call recording, but you can do it live as well. And this is a child welfare use case where somebody is actually reporting abuse. And so it's going to take all the information that you feed on the left. So on the left is the entire transcript of the information. And it's going to populate the information on the right, which is who's the reporter, what is their address, what is the date, who's the victim. It's going to populate all that information from this transcript directly. And so this is an example where if you think of it from a live scenario, I could be the staff who's the call center staff. I'm interacting with the family. I could just focus on asking the right questions. And when I ask the right questions, it creates the summary for me and it says, hey, here is all the information that I got. Here was the name of the person. Here's their address. So as you can see here, it says name is Laura Johnson. And it understood that this is the reporter and not the victim based on the transcript, because it knows who's the person who's reporting. And then it got the address, as you can see, where it said it was a teacher, Laura Johnson, and she said, this thing happened at school, and here's the address of the school. So it knows that the reporter is at the school and she's a teacher. And then here you can see the information on the kid, and then you can see the information on the perpetrator as well. So it pre-populates all of these fields for you. And then if you think about it from a real-life perspective, we probably won't push this into the system. We'll probably have the worker validate it and then push it into the system. But you didn't have to do the data entry. You were just talking to the individual, right? That is what AI is doing for you. It's taking the boring, repetitive task away of doing data entry. So this is another example that we had from a staff perspective. When you think of other things like navigating complex policies, making things easy, this is going to sound cheesy, but I personally believe, my wife gives me a lot of crap for this, but I personally believe that AI truly has the potential of bringing social back into social services. When we used to do social services 10, 20 years ago, a lot of it was done on paper, but at least we were interacting with the families and things like that. We are now in this complicated environment of so many different systems, forms, pages, all of this stuff, where a lot of times our job feels like we are doing data entry, or we are just filling out this report or filling this information. This truly has the option of going back and saying, how can I get you to a better economic place? How can I get you to a better health place? Like, we can truly focus on the social aspect of social services. So these are some of the use cases. We have some around IT operations and supervisors, but in the interest of time, we're gonna skip over them. And the last thing I'm gonna leave you with is the trustworthy AI. So we spoke about generative AI, the different use cases examples. What are some things to be aware of before embarking on this journey? There is a lot on here in terms of risks. There are 3 that I will highlight to you. The first one is bias. If you go to ChatGPT today and you say, complete this sentence with 1 word, and you say, he works at an office, he is a, it'll say manager. You change the he to she, it says secretary. There is bias built into these models. And these biases are there because the underlying data that is there on the internet that it has been trained on has these biases. So be aware of the biases that exist in these different models and how in your use case or in whatever you're trying to do with AI, if it applies or doesn't apply, and what's the degree to which you need to control it. So there's one around bias. The second around cost. ChatGPT is great for individual use. When you think of ChatGPT or any of these similar technologies across the entire organization, it's going to be very expensive. So you have to think about what is the operational cost, what is the IT cost, and what is the training and change management cost of adopting these technologies. So you have to consider those aspects when you're going through it. The last one I'll cover is hallucination. So one thing that we didn't speak about is, because it's human language, there's this term called hallucination. It just means that AI makes stuff up. It lies. So the other day I was researching something and I said, I was asking ChatGPT and Google Bard both these questions, and I said, can you give me the top books on the impact of labor market on the technology sector? It made up a bunch of things and it said, here are the top 10 books. Only 3 of those 10 books were real. The 7 books just sounded real.
But what did Brock say?
Yeah. and so that's the concept. When you think about AI, because it is all it's doing is mimicking human language, sometimes it'll just make stuff up to please you, which may not be grounded in reality. So be aware of that concept as you think about these AI technologies. The last thing is this trustworthy AI. So this is the fundamental framework on which, when Dr. Green was talking about the Health and Human Services Chief AI Officer, Greg Singleton, putting something out there, it's the same concept that it applies to. I'll cover 2 or 3 of these. The one that we haven't talked about is responsible and accountable. Just because we can do it, should we do it? I think that is a fundamental question to be asking about any AI use case. Just because we can do it, should we do it? The second one is around transparency and explainability. If we put an AI thing out there, can we explain why it is giving the answer it's giving? Right now, many of these models cannot explain why they're coming up with their answer. You can take the best experts of the world and say, can you tell me why did it come up with that answer? And the closest you'll get to is, that's what a human would have said. But they cannot fully explain why did it give the answer that it gave. And the last one is around safety and security. When you think about the data that the model is being trained on, when you think about the information that you're doing, are you comfortable with taking the information of your family and sending it out into the internet? You will not be, right? So what are some of these parameters and guardrails that you need to put in place to make it effective for you, but also for it to be safe? You don't want the information to be getting out without someone's consent, without someone saying, yes, I agree to this. So those are some of the aspects from a trustworthy AI place that apply. I would encourage you, the detailed report that Dr. Green highlighted has some of these detailed out with some examples on how you should think about these and what are some good applications of it and what are some bad applications of it. So I think that's our presentation. We had the same question now that you know the answers or the options that are available. Just wanted to see how many are still in the optimistic world with AI. All right. Cautiously optimistic. All right.
Same.
Neutral. All right. I wasn't able to convince you. I need to do a better job presenting next time. Skeptical. Optimistic and skeptical. Negative. All right. Is Gen AI the generation after millennials? I hope no one says yes to that. Okay.
And
So-
I'll tell you why I'm still neutral. It's because of the 30% or the
Yeah.
33% accuracy. I personally, we're working hard on making sure that we capture and clean up the data as much as possible when we build these models to get those to a much more accurate. We want to be 95, 99% and not anywhere below that to be able to say we're confident.
Awesome. So thank you again so much for your time and for listening to us. I'm going to hand it off to Dr. Green.
Thank you very much. And so what we're going to do now is we're just going to take, since we're running a little bit behind, we're going to take a 5-minute break. If you want to get refreshments, we have some coffee and some donuts and some food in the conference room, a restroom straight down to the right and to the left. You can use the restroom. But we're going to return here at 2:30, no later than 2:35. And we're going to continue with our panel discussion, make sure that we can get any questions that you have answered about AI, and then we will kind of conclude and have an opportunity to talk and network thereafter. So let's take a 5-minute break, and we'll reconvene here right around 2:30, no later than 2:35. If I can get our panelists to. So I know we have people that are still using the restroom. We have people still enjoying their coffee and snacks. But we're going to go ahead and get started for the sake of time because I want to leave some time towards the end to make sure that you have an opportunity to talk and to network with each other and really learn about some applications of AI. And so what I'd like to do is just have each of the panelists, we'll start with Archie here, just introduce themselves, talk a little bit about their department and their role and within the department. And so after each of the panelists have introduced themselves, and we'll give our representatives from Deloitte a quick introduction of their background and how they got into this space. Then we'll dive into some questions specific to what's happening in Palm Beach County within our department, and questions that are more general in terms of how AI can be used and applied to the health and human services space. What I encourage you to do is to think about questions that you have. Think about your area of work. Think about ways that you might be able to innovate. Think about some of the concerns that you may have. And we'll have the opportunity to get those questions answered by our expert panelists here. And hopefully you'll leave here today with renewed vigor about the use of AI and how it can be applied to improve and enhance your work. So we'll begin with allowing Archie Satchell to introduce himself and just talk a little bit about the work that you do.
Good afternoon, everyone. So as James said, Archie Satchell. I'm the CIO for Palm Beach County, which is the Chief Information Officer, and in charge of the centralized IT department. So our role in the county is to really, apart from policy, but to assist the agencies in their mission-critical services that they provide. So we provide the infrastructure and the applications that help the agencies to serve the constituents in terms of providing county services using all the technology that's available to us.
Okay. All right, Taruna.
Good afternoon. My name is Taruna Malhotra. I'm the Deputy Director for Department of Community Services. So as you look at it, at our mission, to promote independence and enhance the quality of life in Palm Beach County by providing effective and essential services. So we all are providing a lot of services, and that's one of our mission. But our really goal is to how to get these services effectively to our community. So that's what we do in community services, and we oversee all the health and human services programs. And we are kind of very unique in Palm Beach County. So we not only just do the direct services, we also work with a lot of our nonprofit partners to get these services out in the community.
All right. Naman.
Chaurasia. I introduced myself, AI expert in health and human services, and our job is to help you further your mission. We are really not here to be in the limelight or anything like that. We are in the background. Tell us what are some of the problems you're facing, and let us bring in some new thoughtware and solutions to make you meet your mission better.
So Mohammad, Fasihi, and very similar to what Naman just said about us being able to answer a lot of your questions, but I would add, I do work in 24 different states, and I work in 3 specific municipalities, one of them being Miami-Dade County, San Francisco, and also New York. So I get the luxury of being able to travel and not be home and being told by my kids all the time I'm never home, right? But I do get to see a lot of what's going on at the state and local level. And would love to be able to answer any questions that you would have about how other states, other smaller municipalities, other cities are handling it, because this is something that's coming. It's coming very fast, and all of the vendors that are out there, such as Google, Amazon, Microsoft, they're all going to be in the playground, and they're all going to be offering their services as well. So this puts a bit of a load on Taruna and Archie to make those decisions on what are those best tools that would be able to help you as you're doing your everyday job.
So let's begin by talking to Palm Beach County's Chief Information Officer, Archie. Archie, just in general, what are your thoughts about AI, and how is the county kind of approaching artificial intelligence at this point?
Thanks, James. I was in the camp of the very optimistic, but I'm also cautiously optimistic. I mean, it's just the IT person me. But, we're looking hard and fast at AI in the county. We're doing a lot of proof of concepts now with some of the big players, the Microsoft, the Amazon, Google, IBM, to just look and see what model is going to work best for us. Because there's two ways that we're going to do this. We have to look at, and it was brought up earlier too about, we're looking at a closed system for certain things, especially things for the internal, and then an open system for the outside, because we got to be careful with that data. So we're doing a lot of proof of concept as to where we're going to go with this, and we're also looking at some peripheral software that was going to help, especially like in health and human services. One of the biggest thing, and we talked about, is do client matching. But a lot of what you saw was trying to do client matching. Now, there's an art behind that, and there's software behind that, but it's very complex. So we're looking at those software to see how that can help us, because you don't want to get the wrong client. So we're looking at those proof of concept too, so we can automate more as we look at doing this. And as I said before, to augment all the work that we're doing.
Okay, very good. And Taruna, if you want to just share a little bit about how community services has embraced technology over the past couple of years, especially during the pandemic, and then just share a little bit about what you envision in terms of the use of AI integrated into our work.
Yeah, thank you, James. So definitely, during pandemic, we had influx of work, right? Limited staffing. By embracing technology, we were able to get $200 million out in the community through direct services. That's a lot of dollars, lot of transactions. By using of technology, we were able to work with our utility companies, able to get the bills directly from FPNL, able to get the reconnection information through these bots and RPM, which Naman talked about it, to these providers. But it really helped our case managers to not get bogged down on what is the service date, what's the disconnection date. Didn't have somebody to sit and send those disconnection renewal notices or whatever that requirements for FPNL by end of the day, so that the next day the person can get the electricity back. Talking about filling up the application. So if the client is already established client in our system and have got a service in last 8 months or last 6 months, and it helps, we have to think about it, the decision making still lies with us, how long we need to use that data. Is this data good for 3 months? Is this data good for 8 months? But we were able to look at that information and make those decisions so the client does not have to keep on applying for that information. It also helped us to kind of, do a lot of fraud detection. With so much of money, we saw a lot of fraud in our community, unfortunately. And that really hurt for the folks who really need our services, because that money is not going to them. So we were able to do a lot of matching with our property appraiser records, with our tax collector records, to match the property owners and make sure that their properties are not homesteaded. If they are homesteaded and they are renting it, making sure that they are doing their, making sure that they are paying those taxes. So there are a lot of things which we were able to do it through technology. One of our strategic priority is access of services, making sure that the clients are able to access services. So we embrace technology by providing that. Going forward, what we are hoping to help with some of the assessments we are doing with our clients. The assessments, What we do, sometimes these assessments are old assessments done a year ago when the clients, homeless clients, enter in our system. Things change. There are a lot of touch point for that client when the case manager is talking to that client. But the assessment doesn't change. The assessment is still the old 4 months, but the risk has changed for that client, and how we can use the information which is coming through our call centers, which is coming through our case management notes, it's coming through different benefits which we have already provided that client, and then get those assessments updated in real time to make some decisions to get that client out from the street and get them housed. So these are some of the things which we are hoping to accomplish.
Archie, yes?
Yeah, just to add to what Taruna was saying. So I just saw in the presentation before, there's a lot of technology there. So what she explained earlier was we were using RPA, which is a robotic process automation, to do a lot of this. But the key is the partnership that we work with together to ensure that their needs are being met and we are providing accurate service to further the mission in my mind. So what it is too, though, is that going forward, we're looking at a lot of these, what Taruna just said about looking at the case notes, looking at certain things so we can reduce data entry, reduce the screens that they have to go through, especially in the call center, to help them to move forward with that. So we'll probably talk about it later on, but call centers are another area that we're looking at strongly, how we can use the new technology to make that more efficient.
Yeah. So, Mo and Naman, we were talking a little bit earlier about the use of AI at call centers. How many of you guys in the audience have called for a credit card or something and you've gotten a robot? Anybody? It's pretty frustrating, right?
Oh, yeah.
That's not going to work for us, right? It's not going to work for us. So what do you see as some of the challenges with implementing AI in like call centers right now? But what might that look like in the future, just from your perspective?
So let me address a couple of things in that question, and then Mo would love your perspectives. From a challenge perspective for a call center, you cannot really say, let me take a generative AI application and let me answer all the questions that are coming in. Because even though it'll be able to understand what are all the different services I'm providing and perhaps provide a right answer, we spoke about hallucination. So one of the biggest challenges is going to be, you never know when AI is making stuff up. So when you think of yourself as a county department, authority and being accurate with information is one of the primary things that people are looking at. So if you're wrong 20% of the time and you have exposed AI to it, what kind of legal risks does that open up to you, right? What is the cost of providing wrong information in terms of starting with legal costs all the way through trust, where no one's going to call that agent or that automated thing because I don't know if that information is accurate or not. So that is one of the biggest challenges. The second challenge is also cost. Generative AI is just a year old, and some of these technologies at scale are really, really expensive. So how do you decide that I need a Swift knife for this versus I need a big hammer, right? Like, we shouldn't look at this as a hammer trying to look for a nail. Let's decide what the nail is, and let's decide the size of the hammer and use the right tool for the right job. So those are two biggest challenges I see is the accuracy of information and the cost of these solutions.
So I do spend a lot of time with call centers throughout the country, and there's a lot of challenges that I see with call centers. One of the biggest ones I've noticed is training up your call center agents, making sure that they understand what they're doing and how they're answering the questions, helping the agent become smarter, right? Some of them are AI-generated tools, some of them are not. It's just being able to find your knowledge base very quickly when you're on the phone and you're talking to the constituents that are asking the questions or asking about their specific record or their specific correspondence that they had emailed back. Now, when I think about the future and I think about future challenges that could be coming up, I don't know if any of you guys have received text messages from a bot where they say, oh, hi, there's a party at this date, and you say, well, I'm not that person. And then the bot responds back with, oh, I'm so sorry, do you still want to be friends? right? So, or can I have your WhatsApp number? Now, that it's just a matter of time before some AI thing starts calling your call center up and starts loading up your call centers, and now your agents are talking to somebody that's AI, right? And that's where the challenges come up, and that's where you have to have your defenses up. And I know for Archie, those are the things that you'll be thinking about as you're putting up all of your cyber and your cybersecurity stuff. So there's a lot that's out there for, and I'm talking 5-6 years, I don't know if it's 5 or 6, it could be sooner, but those are the type of challenges that call centers have. And it's, you have to have people, human there to be able to decipher, is this a real person that's calling? And then at the same time, being able to navigate the system and being able to only release information based on verification of the person, right? So that trust has to be there. A lot of times where if someone's email gets hacked into, you have access to all of the different accounts. If you have access to all of the different accounts, a lot of times we might email our own driver's license to ourselves just to keep it because it's in the cloud and we can have access to it or so forth, or another document that might have our information in there. And if they have that information, they can call up your call center agent and be able to give that information, and then you can release information out. So those are the type of things where we'd have to go into figuring out how to identity proof or do identity proofing a little bit better on the call centers to be able to know that who you're talking to and what type of information you're about to release. So those are some of the challenges that I see that AI could be good for, and also we have to be ready for the negative AI as well.
Yeah, in terms of a future of a call center, because that was the second part of your question, I see it as an interaction not just between two people anymore, not just the person picking up the call and the person who made the call, but AI being there to help both of you. So in terms of a future of a call center, what I see it as, hey, the person just said this, you might want to ask this question. So there being almost a co-pilot on the call that is trying to do data entry for you, that is trying to prompt you as a staff to say, ask them about this because they just said this and this is what changed on their case before. So I see that, and for any of you who have used translation services or language line or language link or whatnot, like using AI to do some of your translations. So I do see it as, instead of being just a bi-directional conversation, it's a tri-directional conversation where AI is actually helping in that conversation, but starting again from a safety point of view, from a staff side, not taking AI and saying, well, my resident or my constituent, just go talk to my AI, right? Like they'll figure it out for you, but actually AI with the staff helping serve customers is what I see as the future.
And one of the benefits too is the efficiency you're going to get there though is not to really replace them, but is to get the constituent in the right queue, because you can use the AI technology to help to get them to the right person, right agent with a skill set. So those are the things that we've been looking at to see how we can leverage not having the constituent on the phone just waiting behind, but getting them to the right spot quickly.
Right. And I think one of the things which we are hoping to accomplish with our call center is to reduce the wait time. I'm sure you call AT&T, 1 hour, 20 minutes wait.
Yeah.
By the way, our wait time is 11 minutes. Because we have done a lot of our process improvements. You know, we may not see it. Our staff sometimes doesn't see it, but there has been a lot of process improvement which is happening because of AI, which has reduced that call wait time. But one of the things which we are hoping to accomplish, to give the tools to that call center agent. Currently, they have to go to 5 different systems, figure it out, all the case notes, and then also build the accountability for the client we are serving. Hey, you are calling me 10 times, but you missed your 5 appointments, right? That's a waste of time for the case manager. Right now, our call center agents are not able to give this information. It's there. So we are hoping that we can create some of these efficiencies to bring this accountability in our work as well at the client level.
Absolutely. And I want to pause here to make sure that you guys know that you can ask questions as well. And for those of you who are participating online, if you have a question, you can just type it online, and we have staff who can communicate and convey those questions to us. So we want this to be an interactive session. We want to make sure that you get the most out of this session and can apply the information when it's time. So we have a few questions. what are some of the common misconceptions around AI, and especially in the health and human services space? What are some of those myths that you've heard that we need to really debunk at this point? And that'll be something for any of you to answer.
Well, one thing that I hear a lot, Taruna was asking me, she's like, so do you do like 3 or 4 of these presentations? And I'm like, I've done 120 of these. So we have heard a lot of things from communities around what are some staff concerns, what are some resident concerns, what are some management concerns with this. The top 2 or 3 things that we hear about, one we have already spoken about, is AI here to replace me? The answer is no. AI is here to assist you, and AI is here to make you more efficient in the job you do, so you can focus on customer service rather than data entry or research or things like that. So one is that myth. The second myth is around, well, can't I just use these technologies in my everyday job and just go about it? I don't know if it is a myth or if it is, after these conversations, some of the interactions are, let me just go and have ChatGPT do this for me. And so there is a cautionary tale there, which is, don't just rely upon one tool that is out there to be your end-all, be-all. And the myth there is one tool can solve all of my problems. The reality is it never is the case. It is a combination of tools and changing of the processes. We talk about, when we wrote this research paper, I didn't believe that this was the case, but one of the researchers found this. When they were looking at modernizing postal services, they actually put a piece of mail on a rocket because they wanted to deliver mail faster. And so obviously that didn't succeed, and we have email now and all of this. But my point there being, don't just think about, here is how I do work today, let me apply AI on top of it and it'll be better. You have to rethink the way you do that work for your AI to be maximized in terms of value.
Yeah, for me, what I see is AI will, one of the myths is AI will fix it.
Yeah.
And I think it's not that AI fixes it. AI might speed things up. AI might bring efficiency. AI might bring in aid. But the fixing is something that we would have to do. We still have to be there. We still have to put our eyes on it. And then when it comes to systems and actual legacy databases and what we have for technology, that's something that, Archie, I know that's top of mind for you, is how do we adjust those applications to be able to provide the data and bring the data over? A lot of times when I'm seeing with government is the data is sitting in systems that are COBOL-based or they're much older language. That language doesn't necessarily work with our new phones and our new, on-the-go technology that we use. So bringing that over, converting that over, and being able to use that before AI could actually be implemented. So it takes a little bit of time to do that before you can push AI in.
Yeah, the good thing is we went from COBOL a long time ago. So.
Good.
I'm gonna invite Rebecca up to pass the mic. I saw Tammy had a question.
Drop the mic.
First, and then we'll pass the mic to Doris after Tammy.
Tammy's limited to one question.
Good afternoon, and I'm
If you would introduce yourself first.
Sure.
Please.
I'm Tammy Fields, Assistant County Administrator. And my question's mostly to you, Newman. You made a comment in the last presentation about bias, and then also just made the comment about not doing things the way we'd always been doing it when we're implementing AI. And I know that there's a lot of systems in place where racial bias is being applied, and just the fact that someone is black is ending up with a different result, even if all of the other factors are the same. What's being done to try and address that so that that's not carrying over into all of the AI spaces? Because if we continue to apply those biases, we're going to continue to have the same results.
Yeah. I'll answer this question from 3 different lenses where what is being done about bias. The first one is from a legislative standpoint. You have guidances coming from executive orders or that federal agencies are putting out in terms of specific requirements that you can put out. So, for example, if you're talking about the call center or whatever use case you want to put out, making that part of your requirements, that here is the business problem that we are trying to solve, but here are some standards in terms of bias that I want your solution to go and meet, is probably the first place to start. So having some regulations and rules around what is acceptable and what is not acceptable, or what is the minimum standard, is number one. Second is, I gave a famous example of ChatGPT because all of you can relate to it, but there are many other models out there from a technology and a vendor standpoint that are actually building these as their primary focus, that I'm going to build a model that is, that controls for all of these parameters. There probably is never going to be a tool that is free from bias, because bias exists in all of us, and hence anything that is created as a byproduct of all of us will have inherent bias in it. But what are the protections you're going to have? So, for example, I'm working with a state agency right now where we're actually putting in some guardrails around if this is not meeting these standards, the response back that the chatbot or the Q&A provides is going to be, I don't know, you need to research this more, rather than giving out an answer that may potentially be harmful or be biased. So those are some things. I would say the third is more of a societal thing, which is, all of us collectively are responsible for it. And so when you see these technologies and tools, you can hear the top executives from any of these companies talk about their tools. One of the biggest things they bring is, these tools are out there, but we know that they need frameworks around them. And we are working on these frameworks. We are working on improving the responsiveness and the ethics and the control for it. But the reality is that stuff is going to take time for you to say, I can just apply this tool and it be biased. So I would probably say regulation, and the second thing being, just because we can do this, should we do this? As being one of your primary guiding principles of where should I apply AI to? Because I don't think AI should be applied everywhere. I think there are right use cases for it, and there is a right way of doing it. And you should make that use case driven and value driven.
Just add to what Newman said, but it's an age-old saying, trust but verify, right?
Yeah.
You're going to trust what you get, but you're going to verify. But the technology is there, and it's up to us, the technologists, to start training that model. We need to see when these biases are coming, and then retrain the model to limit that bias. Because not on the race, it may look at something and says, hey, this zip code right here, there's something with the zip code, based on what I'm seeing, that we're going to do a different thing. So hopefully, with these technologies coming, it's going to allow us, the technologists, to be able to train that model or see the bias, and you want to get it down to a manageable level, but you still got to trust and verify every time. It's always on us to ensure that what we're giving out is accurate, and just not sit back and say, oh, this thing did it, it should be right. So that's what it is.
But I think there's also decision making at the
Yeah.
at the case management level, and I'm talking about our environment, right? We have a case manager and a reviewer and approver and a supervisor. That's where you can use some of that guidelines or the to make sure that when the information is going to that supervisor for approval, they have those tools to make that decision, that how this case has been handled, how this assessment has been handled, but most importantly, did this client got the right benefit that this client needed to be successful and be self-sufficient. So I think there is definitely this decision-making, and a human involvement is definitely required in every AI process we talk about it.
And I think I may have heard you during your presentation mention something about utilizing AI to review documents for biases. Are you seeing communities embrace AI from that perspective?
Yeah, we're actually seeing, it is interesting that we are seeing the problems of AI be solved by AI. So when Archie was talking about, think about what are you training that model on, we are actually seeing a lot of agencies say, can you run our underlying data through this model and identify where are there redundancies, where are there biases, and things like that, so I can make a first step improvement right then and there rather than do a manual review each and every time. I'm still going to have human in the loop to verify something and to authorize something, but before that, can I make that person's job easier? So we are actually seeing the underlying data be questioned because Mo mentioned this point, but I do want to underscore that point. AI requires a lot of things below it. It's kind of like an iceberg. You just see the tip, which is AI, but underneath that iceberg is your fundamental, what is the data that you're training it on? What are the applications that you're going to train it on? And so you got to make sure that everything that is underneath that tip of the iceberg is actually solid in place before you start focusing on the tip.
All right, very good. So we have a question. Doris, introduce yourself, and then if we have an online question, so we can bring that down as well. All right?
So my name is Doris Davis. I didn't know the microphone was so loud. My name is Doris Davis. I'm a training program coordinator with Community Services. And because, just as you guys are discussing, it's there, we can use it, but should we always use it? For some of us that work with a lot of data, what are, I guess, some recommendations for AI tools that we can use or that workers can use that are at their fingertips on the internet? Because I know there's OpenChat GPT and there's some other platforms, and just trying to, I mean, because it's there, Archie.
I know.
You know, people are going to go to it, and you're not going to be
making
able
me
to.
sweat.
You can't keep us from the internet. So
We need to update our training manual, by the way.
yeah. So yeah, because it's real, it's out there. We can use it. We can get to it. So I think that we need to talk about what our workers can use, how we can use it, what they can and cannot do, because it's there and it's at our, it's at our
Right.
yeah, it's at our fingertips.
But two things, right? You might have said it before, not because it's there, not because it can use ChatGPT, meaning to use or any AI model. We're actually coming out we have a draft AI use policy, especially because remember, these tools are in the internet sphere, right? You put some client data out there, guess what? It's out there. So you again, you got to use that, understand what this tool is, and you're on the internet putting stuff in. You even said it earlier, would you put your information out there? So why would you want to put somebody else's? So you guys got to be careful. No, policies and processes, that's one thing. If that it can do, but once it comes on to, don't go ask it to go summarize this client case. don't do that. But we're coming with a part, and just for, if there's non-county people, you should always have a guardrail, just an acceptable use policy. We're not saying don't use it, but we're just saying you got to use it responsibly, and there's some do's and some don'ts. And you should know we protect that client data or certain information. Do not put it in any search engine, any AI engine. It's just, I won't sleep at night.
So, I'll share
Thank you,
some of what we do at Deloitte, since we do have a lot of client data, and we work with just about every one of the federal agencies, government agencies, and our commercial clients. We don't allow our employees to use ChatGPT on their Deloitte laptops. You have to get special permission, and it is monitored on how you're using it. The other is the way, if you use ChatGPT or you use any of the AI tools that are not regulated, and you take that data that you get from there, right? First, you're putting the data out there, which is a huge risk, right? And then you bring that data back in, and now it's sitting in your database. When you start using your AI, it's going to use that data to create the results in the future. So you will be creating some sort of biased results, which will then require even more cleanup and stuff like that. So I would highly recommend not to use any of those systems. Even if it's like a gray area, don't do it. You know?
And I would say, like, I think number one is obviously follow the AI policy. The second is, because Mo talked about Deloitte, yes, we are not allowed to use ChatGPT, but there is a specific GPT that the firm built for us. It's called Sidekick. It's a chatbot tool that's available on our internet. That is available for us. The data stays within our environment, and there are some policies of what you can put in there and what not. I do see, as more and more sensitivity forms around this, there are going to be more tools like that that are going to be customized to that agency, where it's like your data stays with you. It's very similar to when cloud came along,
Right.
and it was, are we comfortable putting our clients' data on the cloud? And then over time, what came around was like in 1, 2, 3 years, there were rules, what you can put, what you cannot put. I see the same thing happening with AI.
And the same, we're looking to actually do the same thing. We're going to put a closed engine for our internal use that you can use it for, and that's why we're doing the proof of concepts to see how those are going to work.
Yep.
There's an online question.
It's loud, isn't it?
So we'll get
Yeah.
the question from Daniel, if you want to introduce yourself first, and then we'll take the online question.
I'm Daniel. I'm the Director of Systems Integration for Southeast Florida Behavioral Health Network. Just follow-up question first. So the main reason you don't allow them to use ChatGPT is because of the two-way nature of what they're putting into the system and where that ends up? Is that the main reason?
We don't know where it ends up.
Right.
Not, because we don't know which, first of all,
Yeah.
we have so much data that's PHI.
Right.
We don't want it outside of U.S. at all.
Yeah.
Those servers could be taking it outside of the U.S., and we don't know how they could use it. So we don't even want, like, your first name, last name, zip code,
Right.
right? That you could find on the internet, but we don't want any of our systems or our laptops pushing any of that data out.
Right. So Microsoft just came out with Bing Chat Enterprise, which they're now calling Copilot for reasons. So that would be okay in your mind.
No.
If we bought Microsoft and then we created our own version of it in our environment, then yes.
No.
But they're saying that our interactions with Copilot don't go to their servers, are not kept by them or anything like that. It's
It goes
completely
somewhere now.
protected.
There's software behind here, right? They're using OpenAI, the same engine that is behind ChatGPT to do that, right? Whatever it is, you just put some information out in the stratosphere that you don't know where it is, and somebody has that now. And when one of the worst case I heard was somewhere somebody put their whole Homeland Security policy into ChatGPT. It's like unbelievable. You can't do that. So now that policy's out there. When I go search, I'm going to pull that information. Somebody in China
Well,
can
that's
go
what
pull
I'm
that
saying,
information.
though, is that Microsoft, for this is a special version of ChatGPT just for enterprises, where they're saying that doesn't happen. That none of what we do is used to train the model.
If it's internal, yes. Okay, so it's the same thing
Exactly.
we're looking at. We're looking at their OpenAI engine that's sitting, but we're trying to make it sit behind our wall
Right.
and how we get to it.
Right.
Right. So it's still out there, but it's not being sent to the
Right.
to the
So
stratosphere.
the example that Mo was saying, where they said don't use OpenChatGPT, when we created our version of what we're calling Sidekick,
Right.
we actually have an exclusive agreement with a cloud service provider that says, this is our tool.
Yeah.
The data that we feed it, you will not use it to train any of your models. The data that we send to you, you will delete. There is no retention of
Right.
that data. So when we had those agreements in place, we used the enterprise version of that. So I think
Yeah, that's
that is the
exactly
big
what-
difference.
that's
is
exactly
the-
what we're talking about.
that
But
is
it's a
the-
little different though, because you have to make sure that you are talking to that vendor, which is Microsoft, and
Yeah.
understand what's going on. Because all of these vendors, like Microsoft, Google, Amazon, they all have, there's a GovCloud version of it that's
Right.
FedRAMP certified, and then there's another version of it that's commercial certified. The commercial certified is worldwide. The one that's FedRAMP certified means that the data never leaves the U.S., and only folks that live in the U.S. could see the back end of that database. And even the servers, only folks that live in the U.S. and are U.S. citizens can then touch that database.
Okay.
So that's
I
where
have
the
to-
extra security comes in, and that's where you have to work through, Archie and
Yeah.
IT and see, is this been certified, and has Microsoft sold the right product to your agency that does have, FedRAMP certification?
Yeah, because the proof of concept we're doing with Microsoft is on the Gov side of it, is not on the commercial side.
Okay, that's good to know. Do I have time for one more question? Or?
It costs
one more-
$10.
So my perspective is that AI today is like the 56K modem, and we're standing at the bottom of an exponential curve. And I had a question for you about how, I think a lot of us would consider ourselves kind of advocates. We're all working in the behavioral healthcare space. I think the social benefit is important to us. And I was wondering, from your perspective, what we could advocate for to help address the control problem, which will almost inevitably be coming up within the next few years if an AGI is made. And OpenAI certainly thinks they're going to do it. So I was just curious from your perspective, if I could say something to my representative or to my legislator, what would I tell them as to what I want them to do to be able to address the control problem?
I mean, I would start with regulation. There is so much talk about regulation, but when you think of the actual number of acts that have been enacted, that's zero. So what you need is regulations that go beyond a foundational of an executive order versus a trustworthy AI framework into specific regulations of here's what you can do and what you cannot do. So I think we need this regulation done at the federal level, at the state level, and at the local level as quickly as possible. I would say that is probably the number one goal or thing that I would say from an advocacy standpoint. This is my personal opinion, I'm skeptical of people who say AGI is just a few years away. I don't know if that is fundamentally true. Like, if you see some of the limitations of these LLMs, they're pretty ordinary. Like, once you get through the hump of, oh, this is so cool, and then you start going into, let me go deeper into this technology, you really start seeing some of the limitations of this technology. And when you think about what it is going to be 10 years from now, 15 years from now, I may be incorrect, but I don't know if we're really that close to AGI.
Ideas are bigger right now than what we could really do. Like people have, and in the behavioral health space, we built a bunch of different applications to be able to identify, to be able to help, to be able to capture, to be able to provide information to them on the spot. And there is so much regulation around privacy that right now the LLM models do not give you that type of privacy at all, right? And there is going to be lots of bias and hallucinations, especially when you're dealing with behavioral health. So that's where that's been one of those where we've gone very slow, right? And we're setting up more on being able to track and being able to identify and being able to enroll people rather than going a little bit further into eligibility and so forth.
All right, let's go with the online question.
It says, how is the community embracing it? Because we are dealing with vulnerable people for the services. Are they able to emotionally accept the participation of AI while dealing with their vulnerability?
Well, I don't know how they're dealing with it, but ethically, there's certain things that we have to do around that, right? And also, on the ethical panels that we're supposed to cite that what we are doing, AI was involved in there. I think that has to be part of all the regulation. You need to be transparent about that, to let them know that AI had some input in making this decision or doing something. So as long as I think we do that and ethically treat it right, I think the citizens will embrace it, because like in the presentation before, once they get that trust and you're open with it, then I think that they'll because they're going to like that, they're going to get things done a little faster.
I'm thinking maybe we can speak to some of the current applications that some community members may not even know AI is behind. So can you speak from that perspective, so that, because I think that it also speaks to what Archie is saying. If they know that AI is currently being used, then that will open things up a little bit more. But I agree that we have to move very slowly and make sure that all of the ethical considerations are considered, which the ethical discussions will talk about in the second half of this discussion.
And it depends on the sector, right?
Yeah.
It just depends on the sector that you're looking. And again, and I think Mo may have brought it up earlier. Remember, AI has been around for a long time, right? AI has been around from the 50s. Artificial intelligence has been around. Gen AI is the new one that a lot of this is being done around. We have been using AI forever in cybersecurity stuff and all. We've been doing that. But the Gen AI is what we're going to really look at, and that's the one that we need to. When we talk about AI, is really, I think Gen AI is the one that we really need to say, because that's where we need to put a lot of. It's so powerful now that, and we'll talk about it later, that even and some you've been touching it earlier. Because it can interpret pictures now, it could break your security sign. If it gets your password, it could it can do that. It can probably start doing facial recognition. So if somebody there's a lot that's going to go happen. So that's why we have to move a little slowly and ensure that we put these guardrails and guidelines around it, because it's going to get very powerful.
And I want to distinguish between one of the things that generative AI has done is blurred the lines between what I would say consumer grade AI and enterprise AI. What I mean by that is, when you think of the tools that you had access to, you could take a Word document, convert it into PDF. You could, search for images on Getty Images or whatever, right?
Yeah.
These were the tools that you had from a consumer grade perspective. But these were not very, very powerful enough for you to redefine the way you did your job. The problem that has happened with generative AI, or one of the byproducts, is because of generative AI, those lines are very blurred right now, where you can go sign up for ChatGPT and do really, really powerful things that could potentially be very damaging as well. I could take in information about, let us say I'm a case manager, I have 200 cases, just load it all on there and say, hey, can you summarize these for me and tell me what's going on? I think that is a great use of it as an employee, but I might be causing a massive headache to my organization and to my community and to the people that I'm serving. So that line between what is consumer grade AI, which is, yes, that is there, these are the things that you use it for, versus enterprise AI, which is what has Archie and his organization said that is okay for me to use and not okay for me to use, that line is very blurred. And so that is going to take some finagling over time to kind of separate out.
Yeah, and that's the difficulty in coming up with our policy, right? We have a draft policy, but the difficulty is that if you want to create a PowerPoint presentation that doesn't have proprietary information in there, go for it. Yeah. So I don't want to tell you not to use ChatGPT to do that. But you don't want to take an email and put it there to respond that has some sensitive information in there. You just don't want to do that because you want to write. Go get Grammarly to do something else, to get that email. But and that's what, and because the policy, it's more of a guidance, because it can't be a policy right now. It's more of a guidance that we can ensure that you're using it responsibly and using it for what you can. You can just say, give me an outline. Give me an outline for a PowerPoint. It will do it, and that's helpful.
All right, we have some questions on this side of the room.
Hello, my name is Rainisha Williams. I'm the Director of Customer Service and Communications with Palm Beach County Water Utilities. My question is for Mr. Archie. Do you think we'll be able to have some form of internal system with AI that could possibly communicate with our IVR phone system so that we could generate transcripts for the phone calls that we're receiving inside the call center?
Correct. So that's a great use case that we'd talk about for our call center. We're moving to a new call center now with a little bit of capabilities. And by doing that, we're going to be applying AI to our just internal engine that allow you to play those transcripts back and do just some of what you see with the data entry and things like that. So hopefully that's what we're looking at. But we still want to make sure the models and can handle it and just ensure we're doing it right. That's the only reason. It's there to be done, but we still got to be cautious, right? You just don't want to just throw it out there. We want to really be cautious because of what we're dealing with. People may be giving you information that we need to figure out, oh, this needs to be encrypted. There are certain things that we need to do once you deconstruct that WAV file. But yes, we will be doing that.
Okay. Any other questions from the audience before we go? Go ahead, Rebecca.
Hi, I'm Becky Schnerman with the Palm Beach County Parks and Recreation Department. I would love to do any of your proof of concepts if you want to beta test with our department. Totally on board. But my question is more with fraud. Because of AI and people using AI, is there any fear with people using AI to fraudulently submit applications for all of these benefits and then getting them,
Yes.
and how do you check that with your systems now?
So at Deloitte, we call this threat AI. So when I was telling you about some of the myths of AI and things like that, one of the things I hear about is AI shpAI. It's not going to happen. I don't need to worry about it. And the reality is, whether you want to embrace it for your internal operations or not, the society around you and the partners around you are doing AI, whether you like it or not. So yes, it is true. We look at threat AI in three different dimensions. One is fraudulent applications. One is incorrect accessing of information, so someone hacking into someone's account. So, not by brute force password detection, but now using generative AI, which is much more powerful and can understand a user's thing and do it. And the third one is around misinformation. So those are the three things that we call it under threat AI, which is people using AI to kind of gamify the system, if you may. There are specific tools that are available on the market that do things. So for example, I work with a health and human services agencies that has implemented a new software that detects if a driver's license or a passport has been modified when someone is applying for benefits and they're providing proof of identity, because technically I can go and I can use some software to create a driver's license for me in the state of Arizona, and it'll do it. It'll do a good job. But you have now softwares that sit on top of it to detect those kinds of fraud and prevent those kinds of things. I think over time you're going to see more of niche players play in the market and say, here are certain tools that can help you with identity verification. Here are some tools that can prevent with potential bot-created user accounts or things like that. But there are tools out there in the market that do this.
And we're looking at those tools too, right? But again, and we look at third party to take the liability off us, because a lot of those is doing facial recognition. I see one when you submit your driver's license, then you got to take a selfie and upload it at the same time, right? So there's certain things around biometrics that we're looking at. But our constituents in Palm Beach County, especially, is that that certain demographics. So we got to look and see how we can put some form of protection around them, so we can identify that this is who they say they are. Yeah.
And with all this influx of work which we have seen in our department, we actually saw that people were uploading all these PDF documents which were fraudulent. So we actually were working, currently on technology where the system can identify all those PDF uploads which are the same for different folks. Mm-hmm. Those are not connected with the households, but they're using the same crisis letter. But one of the things which we are using for this technology is, like, if somebody uploaded an eviction document that they are in the current process with the court system, we can actually look at it, the current court system data, to see if that client is actually in eviction or not, because we are seeing a lot of fraudulent document upload. And these are some good benefits of AI, because if a case manager is reviewing it, they will just take that information that it's a good document, but in actuality, it's a fraudulent information.
Mo, did you have something?
Yeah, so with AI, you're going to have these fraud cases, and there's going to be some folks who are going to be able to use it to really solidify that fraud case to be like really good, to the point where you're like, oh, this is accurate. So this is where some analytics can come into it, where you can do some monitoring. There will never be a way in what I've seen to go to zero fraud. There will be fraud. Now, do you catch it after the fact, or do you catch it before? You should set up your systems to be able to catch a very large % of it before, and then there's the checks and monitoring, and then there's the analytics and review, and a person reviewing it that needs to do that. Because in a lot of times when you have credit applications, I believe what is about 75% of the applications go right through. But then there's 25% of the applications that require some additional checks. And that's where human eyes have to come in, and there has to be some kind of aid or some type of decision that's being made. The other is, do you let AI make decisions? And I think one of the things we've all talked about is maybe AI is not the way to make the decision. AI is there for an aid, but if you let AI make decisions, fraud is going to be actually easier than ever was before.
Yeah, even for example, like, when we do surveys and sometimes we see a huge influx of surveys coming in, so that we do check with, is it a bot-generated surveys? Is it a good data? You may be like really excited about, having a 75% response rate, but, 60% was bot-generated and it's really no good to us.
Any other questions from the audience? All right, I think we had a couple of questions about, so how can it be effectively deployed to streamline eligibility determination and application processing to result in more efficient outcomes? I think we spoke a little bit about that, and there were some challenges with the eligibility piece. Can you talk a little bit more about that and what those challenges are with eligibility? And what are some things that might be considered? What are some things we're doing to overcome those challenges?
I think with eligibility determination, it is really three aspects of it. One is how can constituents access services, information quicker, faster, more streamlined. So I think Commissioner Weiss was talking about why do we need to make a person fill out 10 different paper forms and applications and things like that. So I think the applicability of AI to make that faster, the applicability of AI to help a case manager or caseworker process things faster, and the ability for QA and manager to do those checks. So I know we are talking about call center scripts, but one of the clients that we are working with are using automated QA that is AI powered, and then a human sits on top of it. So instead of having 5 QA people that are QAing, calls by 300 different call center agents, the QA person just says, here is my checklist. AI, can you go and run through this checklist across all the call center transcripts and tell me which ones I need to flag so I can identify which worker do I need to, give feedback to or do a deep dive on. So those are the three aspects in which we see things being more efficient. I think the number one concern across all of these three is data and privacy. And really that is around how do you have the right safeguards in terms of security, privacy, data access, and things like that. So many of the states and agencies that we've been working with have come up with closed LLM models. They have drafted their AI strategy. They have drafted an overall governance framework for here's how we are going to prioritize use cases. This is who's going to approve the use cases. This is how we're going to have feedback. So those are some of the ways that we are seeing those concerns be mitigated.
So I do want to add to what Naman said. We actually use this technology, AI, for during COVID when we did the food applications. So what we did, if a client who's already an established client, and we built up that criteria that who is this client? Is it a established client? Is there any change in any information which they provided in the last application to this application? There were multiple checklist we created that allowed us to get that information from that client and bypass the first level review check and automatically send the good applications which match that criteria to the supervisor to make that approval. That really helped us to process this tremendous amount of application intake which we were getting, and then only the cases which got flagged, we had a QA and another person reviewing that information and then making a decision whether to disperse that benefit or not. But just because of that, we were able to get almost 14,000 applications done within like a couple of months. So that's one good use which we have already done in Palm Beach County.
So when I think of deployments, right, and I think of putting deployments out there, one of the things that I've seen that makes successful deployments is being able to call out the success criteria before we go into it, right? So we call out what would success look like? What would it look like for short-term, long-term, and what would it be for, for the mid-range? And then at the same time, making sure that the folks that are at the agencies who are SMEs are fully engaged and involved. And I know you brought up a little bit earlier that you'd be happy to do beta testing, but that would be needed. Whenever you're deploying something like this, you have to make sure that you're testing it. There's also times where everything in the testing might go perfect and you might not be able to test for something that comes out of left field. In our practice, we do call that at times like monkey testing, which is you just go in there and do whatever and try to see how you can break the system to figure out what's going on and be able to capture how someone from the outside would be able to go in and try to intrude, cause vulnerabilities or intrusions. But the deployments, the main thing is really about getting SMEs involved and making sure that you have success criteria and that you understand that it's not going to be a snap. It's going to happen slowly. You're going to be able to deploy small pieces, maybe pilots at a time or certain populations at a time.
Yeah, I think monitoring is another thing.
Mhm.
Really, we really need to include the monitoring and audit process in these
Mhm.
concepts, because you may have the set criteria, but then your exception reports when you're looking at it, things, because the people who are putting these criteria are human too, and
Yeah.
we all make mistakes as well. So I think that's why we are very big on having that monitoring and audit, especially for all of these automated processes which we are doing to make sure that we are being true to the information and the data.
And the old developer in me is that, you got to include the SMEs, yes, but we can't program for every use case that's out there. And it's gonna come up. It's not just a failure. It's just that there's something new you're going to see they never encountered before. So it's the way to get that feedback loop and then do the correction and then
Exactly.
come back through again and doing that. The same thing with the call center. I mean, don't be using the recording just for discipline, but also for feedback to go back and say, hey, you could have handled this different with this client. That's what it's for. It's not to put the hammer down, but now it's a tool for you to improve how you deliver services and do things like that. So you got to look at it from that aspect.
One of the biggest fundamental shift, since you were talking about from a developer perspective, is we are moving on from binary things to probabilistic things. And with generative AI, that is the biggest thing that is going to be a shift for how this adoption is done, because you cannot predict what it's going to do. You're going to give an input, it's going to give an output. You change one word in your input, the output is going to be significantly different. So it's not like your systems or screens where you can say, I click these buttons, this is what's supposed to happen next. You cannot predict what is supposed to happen next. So to Archie's point, you do have to evaluate, here are my top use cases, because you cannot test for everything. And that's why you need the monitoring component after, because you are going to see some things that were unintended in production. That is just the way.
All right, so we have about 5 minutes remaining in this discussion, and so I want to get to just a couple of more questions. The next one is, what are some of the best practices that you've seen out there in terms of safeguarding your data and making sure that the security challenges are addressed?
It's no different than what we used to do before, not because we have AI or generative AI makes a difference. Encryption, user access, there's all that role still stays there. It doesn't change. Now the difference is what you expose your data to. That's the key. Is what part of the data do you expose? We're seeing in the industry now there's more reliance on data scientists or what they call data managers to know where the data is and what's being exposed. So it doesn't change. The security is still the same security. It's not going to change. It will never change, because you have to put those guardrails around your data to ensure that it doesn't get hacked, doesn't get disseminated, and unless a human take it out and disseminate it, but not from the back end. It's not going to change.
I see two things here. One is making sure that the distribution of the data policy. So, Archie, I know your team usually distributes that data policy probably on an annual basis or some interval to all of the agencies. So making sure, because I know at Deloitte, we do force all of our employees to, when they log into the internet, at some point, they pops up, they have to read it, they have to attest to it, and if for any reason they break it, then someone gives them a call letting them know, hey, you attested to it, you read it, you knew about it, and then you still broke it. And a lot of times, we'll have, well, it was too long, I just didn't read the whole thing, I just clicked yes, and I moved forward. So at that point now, they have to go through a course, and they have to read the whole policy, whether it's 100 pages or 10 pages, But I think that's one of the biggest things is, like Archie said, it's already there. You have to review it. You have to make sure everyone understands what's going on, because if they're about to attempt to take data and put it out to the outside, they have to read that data policy. And then the other is going back and refreshing that data policy to see what's new out there and how can we update it. Those are the two, I think, best practices that you could do for your data.
I think investing in the governance is really important, especially, we all work in social services space. There's so much of critical information and, sometimes client shares, which goes in the case note. So, having a governance structures within our organizations, I think that will really help to build the trust. And then when you are implementing these use cases, to have that mechanism or a structure to go through this information to make sure what we are doing is correct.
To expand on what Mo said, the data policy is one thing, but again, because in the county we have 39 different agencies, right? And the policy around their data is so different. I am the custodian of the data. I don't own the data, right? We don't own it, so we look to the agencies to actually help with some of that policy. I can put the custodial policies out there of how we're going to ensure that we protect and keep and allow you access into what the data. But I'm just giving for everybody is that you need to have your policy within your business unit or agency, how you handle that data, because data is different. There's some data, we're a public agency, right? There's some data that is just public record, but it's different. So you need to really look at those policies within the agencies. It may be different from Health and Human Services from senior services. It may be different for any other in the one agency. So you need to really look at that and ensure that you have those policies and update them on a regular basis.
All right, and we'll end with this question. What measures can be implemented to prevent the unethical use of AI in health and human services? And how can we establish ethical decision-making processes to guide any implementation? And, ethics is such a huge concern with this technology. So any thoughts around ways to prevent that, the unethical use?
So Taruna spoke a little bit about this, which was around governance. I want to expand on when we say governance, what does that actually mean? Because we have seen some of our clients flesh this part out. Governance has multiple angles to it. One is starting with how are we going to select for use cases? How are we collectively as organizations or agencies going to decide that this is something I want to use AI for? The second is involving end users and having communications around it. So education around when we are implementing something AI related, let us say that impacts my end users and staff. Am I explaining that to them? Am I giving them the option to consent in and buy into this process? Or am I just forcing it and I'm just assuming everything's going to be okay? That's the second aspect of it. The third is technology, which is what are the different tools that I'm using and which tool am I using for what purpose? Because ethics is closely tied to these tools, because some of the tools have underlying things that are built into them that you may not know. You may be like, okay, this is fine, let me go use it. But there are some things that are built around it. And the last one I would say, probably the most important one, is change management. Like anything, this technology is new. So explaining this technology, understanding what the implications of that are, and making sure that you're preventing unintended consequences, that is the whole kind of AI governance framework that you set up around it. Now, how you execute that is you have policies in place, you have to have trainings in place, you have to have reinforcements in place, like those kinds of things that you have to do. But that is the overall kind of structure that I would put towards that.
Yeah, and just to put on that, this space is actually a space where you really have to look at the ethical use of this thing in health and human services, especially on the health side of it too. You had this debate with a doctor friend of mine who's in IT that talk about, are you going to let the engine determine who gets care by running? So you have to be careful just how you determine what you get back as to, well, this person is going to may die next week or not, whatever that is. But you got to ethically look at it and not you can use it to benefit yourself too. So it's one of those things that you just really have to put guidelines around to monitor, to ensure that people are not using it unethically, because you can do it, and this space is actually prime space for that. So you've got to be very vigilant about looking at that. Would be gone. So you just got to be careful.
It's all
about
gray
that.
area. All of it is just gray.
Right.
And so the more inclusive you can be in decision making around all the steps in the journey, like I would say inclusivity is the key. Inclusivity and explainability is the key for you to decide your ethics around it, because there is no one place that you're going to find ethics around it, because it's a collective wisdom that you're going to decide around the use of these.
Right, beautiful. So let's give all of our panelists a big round of applause. I mean, there was so much information. It was so rich with information today, and we really appreciate you taking the time to share all of those insights with us. We're going to be sticking around for a little while. We still have some refreshments in the conference room, so we invite you to partake and to use the next 30 minutes or so to interact and to network and to get to know some of these individuals who are on the panel up close and personal, if you don't already. Again, my name is James Green. I'm the director for the Department of Community Services, and we really, really appreciate you taking the time to come out and to hear this information today. And we look forward to engaging with you on this topic in the near future. So thank you again for participating today, and again, we invite you to stay around for refreshments. I see.
I just want to thank you and your team for putting today together. Thank you so much.
Oh, absolutely. Thank you. All right, so that will conclude our session.
Group shot.
I need to put my earring back. It fell.